Living in Central Florida, in Polk County here, we have a very high population of snowbirds that come down, and they love it here, so they decide to spend the rest of their retirement. And family then moves down. The next thing you know, you've got this whole big family unit, and people start sticking around, and of course they age as they're here. And as we think about the end of life, we also consider services like hospice. And one of the great organizations here in Polk County is Good Shepherd Hospice. And here to talk to us about the month of November, and this is special, with us today is Johnsie McAlister. She is Community Relations Representative with Good Shepherd Hospice. Johnsie, thanks for coming on.
Thank you, Steve. It's great to be here.
Now, November is a special month when it comes to hospice. Tell us a little bit about.
Right. The theme for this year is care on your term. And what that means, Steve, is that as a patient dealing with a life-limiting illness, and with hospice's help, we support our patients and their family members, and they're able to decide exactly how much care they want. Do they want a lot of care? Do they just want a little bit of care? So we're able to support them, and we're also giving them all the time and the attention needed to provide as much care, as much quality care that we can provide for them for as much time as they have left remaining.
Okay. Now, when you say quality of care, and you know, when it comes to hospice, that's what hospice is really about, is providing quality end of life services, right? I mean, tell us a little bit about what Good Hospice does.
Good Shepherd Hospice provides care in many different settings. We provide care to patients that live at home, care to patients that live in assisted living facilities, in nursing homes, in hospitals, in our hospice houses, and we've even provided care to patients who really have no home. They're living in a cardboard box under the I-4 bridge embankment. So we're able to provide that patient-centered care, which encompasses both physical, emotional, social, and spiritual issues regarding end of life.
Now, and I have to apologize because I keep saying Good Hospice, and I guess that's just because when
that's okay. We are Good Hospice.
Yeah, when I think of Good Shepherd Hospice, I think of Good Hospice.
Yes.
But when it comes to paying for these services and everything, how does that work? I mean, you guys take donation? Are you?
We do. The majority of our patients do come to us with a pay source intact. It's either usually a Medicare, they're a Medicare beneficiary, they have Florida Medicaid, they have private insurance, and many private insurances do have a hospice benefit. Right. We also do have fundraising events that go on to raise money because we provide care for over, we provide $1 million worth of uncompensated care every year. And these may be patients who fall in that crack. They don't have insurance, but they're too young for Medicare. We take patients regardless of their pay source or their ability to pay, yet they get the exact same treatment and the same services that a Medicare patient would get.
Now, Johnsie, who is it that that is eligible for hospice care through Good Shepherd Hospice?
Anyone who has a life-limiting diagnosis of 6 months or less is eligible for care. Now, in saying that magic 6-month number, it doesn't mean that you will have hospice for 6 months. Many times we've gone out, admitted a patient, and they died within an hour or two. Then we have patients that have been with us for over 2 years, and that's perfectly fine as long as they continue to meet the qualifications of their life-limiting illness, and they do decline. The other great thing is that we care for patients of all ages. We've had children, we've had babies, newborn babies, we've had teenagers. We've taken care of people that are in the prime of their lives, people that are retired, and also people well into their 100s.
And I think that's you know, even I alluded to it in the intro. That's a big misconception about hospice, is we think of the elderly when we think of hospice, but really
that's correct.
It's about taking care of people who are end of life, whether it's young or old.
One of the most amazing things I did as a hospice nurse was get a brand new baby directly home from the hospital where they thought she would die. She was born anencephalic without a brain stem. They thought she would die. She lived for a week or two, and you just don't stay in the hospital anymore. care.
Right.
You have to go somewhere. So the family was able to bring her home. They brought her home to that nursery that was painted, the rocking chair, all of their baby things, and then they had pictures taken. And they were able to care for that patient for the next 2 weeks. So that little baby that they had planned and anticipated for, bring her home, give her love, surrounded in their home with the help of hospice care.
Yeah. And you think about those kinds of situations and how difficult that must be, and how important it is to have an organization like Good Shepherd Hospice to come in, who, this isn't the first time that you guys have experienced this. You know, it's not, you know, you guys know the situation, you understand the situation better than probably anybody. So to have an organization like you guys to come in and partner and stand beside these families that are going through such a hard time, invaluable.
We are trained and experts in pain and symptom management, and many times people think every hospice patient should have pain, and that's not the case, Steve. Sometimes it's just a symptom. How about hiccups? Have you had hiccups for 5 minutes?
It's awful.
You can't eat, you can't drink, you can't sleep. But can you imagine having hiccups not for 5 minutes, but for 5 days? So because we're also well trained and experts, we're able to really know the medicines, working with pharmacists and doctors to get that patient comfortable. So it's much more about than pain, but also symptom management, whatever that symptom is.
And it's not just for the patient either. I mean, you know, for me, I'm thinking if any of my family goes into hospice, I want to know that they're taken care of. There's a little bit of peace of mind there to know that they're in the best hands of care.
Absolutely. It's a support approach that we use. Not only is the patient our primary concern, but their family members, their neighbors, their unit of care that help take care of them. We offer support to all of them to teach them, number one, how to take care of the patient, and then also support them while they're doing it. We're also always available 24/7. We have nurses that answer the phone at 2 a.m., so you're actually talking to a nurse. And if you need a nurse to come, the one nurse is still talking to you on the phone while the other nurse is driving on her way to your house.
Yeah, that's service. That's a good.
It really is.
Yeah, and you know, honestly, when it comes to a hospice service like this, you know, Good Shepherd Hospice is the name that everybody knows. It's the name that everybody recognizes. You guys are doing it right here in Polk County.
We are. We are the oldest hospice that's been doing service in Polk Highlands, Hardee since 1979, and of course we are the only hospice that does have hospice houses.
Right.
We have one in Auburndale, we have one in Sebring, and we're building a brand new one on Lakeland Hills Boulevard in Lakeland. Should be open the end of December. So we're really excited about that. And let me just add that you don't have, hospices don't have to have a hospice house.
Right.
That's not a requirement. So we feel like we're exceeding requirements, and yet we're serving the communities we live in.
And the hospice house is basically your facility that clients can check into to get their hospice care, as opposed to in-home hospice.
Well, they can. However, about 40% of our current Good Shepherd Hospice patients will probably use a hospice house at some point within their care. And hospice houses are inpatient freestanding units, so it's an acute care.
Okay.
So they go to the hospice house for symptoms, pain or symptom management. Suppose they need IV fluids or an IV antibiotic, or maybe they need to have their pain pump installed and regulated. So they go there just for short-term acute care, just like some patients would go to the hospital now.
Right.
However, when you go to the hospital, you're going to have unwanted tests. You're not going to get that peace. You're not going to have a gorgeous surrounding.
Yeah.
All of our hospice houses have private rooms, private baths.
Oh, how
there's
terrific.
a kitchen area. There's a refreshment area with coffee and drinks for the family. The pets are welcome 24 hours a day. Children are welcome 24 hours a day. We have a little library. We have computers where families can actually get on and then Skype with loved ones that are not close.
Oh, that's great.
So it's really just a great experience.
You know, nobody likes going to the hospital.
No, no one
likes
does.
it. And especially in those cases where you're frequenting the hospital, you know, to have somewhere where you can go get that care on a short-term basis, that's terrific. That's really great. Now, Johnsie, you'd mentioned it a little bit earlier, but if somebody wants to enroll in hospice, what is the procedure for that?
Steve, all it takes is one phone call. Either the patient themselves, a loved one, a neighbor, a family member, a member of the clergy, a physician. All it takes is them to make a call and make that referral. Then an appointment will be set up with an RN coming out to do an assessment. If they're admitted into hospice services, the care starts that very day with a very individualized plan of care. So if there's something that patient needs right then, such as a pain med, we're going to get it. And let me just add that we have our own pharmacy, so we work really well with our pharmacist. We have couriers that bring the meds directly to the house. You're not going to Walgreens or Publix and standing in line. You can get them right there that day. And we also provide medical equipment, such as wheelchairs, hospital beds, oxygen, as needed.
That's terrific. Well, you know, it's always great having you guys in here, and it's always a good reminder of the services that are available to people. You know, you don't have to do it on your own.
No, you sure don't. And let me just tell you that our team of hospice professionals are all highly trained, and it consists of a doctor, a registered nurse, a social worker, a counselor, hospice aides, chaplains, and volunteers.
Yeah.
Where else could you get all of that? It's like one-stop shopping.
Full package.
And we support the family and the patients. That's our goal. We also provide bereavement care for up to a year after the loss of the loved one. And let me just emphasize that you don't have to be on hospice services to utilize that care. This is a community service with absolutely no fee involved. So for people who have had a loss, whether it be just a normal natural death or a traumatic event, they're able to get hospice bereavement services. We also have a Bethany Center, which is our children's grief services. We have those in Sebring as well as Auburndale, and we do put on a camp every year where we send over 120 kids to camp. These are kids that have had a hospice death through Good Shepherd or also through the community.
Wow. So many things that you guys do. I mean, it's such a valuable resource. Johnsie, thanks so much for coming on and telling us about November being Hospice Month. And thanks for all that you do.
Oh, you're very welcome. Thank you, Steve.
That's the Good Shepherd Hospice. They're so good at what they do. If you have any loved ones that are, you know, at the end of life and or, you know, diagnosed with a fatal illness or disease, these guys are the first guys that you should be contacting. Like we said, there's no reason that you should try to bear this on your own. Call the people that have the experience that can make this process a little bit better, a lot better for you. Good Shepherd Hospice, there for you. Been around since 1979. What a terrific organization. It's really easy to get in touch with them. Just call them at 863-544-3280. Or you can visit their website at www.chaptershealth.org/hospice.